Good morning. We're in the offices of Mazer, Amundsen, Boggio and Hendricks law firm this morning. My name is Roxanne Cornell. I'm the life care planner and social worker here on staff. This morning we're going to be talking about assisted living and home care services. We have with us this morning Jill Schewe of Care Providers of Minnesota. Good morning, Jill.
Good morning. Thanks for having me here.
Absolutely. Can you tell us a little bit about what you do at Care Providers of Minnesota and what Care Providers of Minnesota even is?
Sure. Care Providers of Minnesota is a long-term care association. So it's a member association, and our members are made up of skilled nursing homes, assisted living, home care providers around the state of Minnesota. And my role with Care Providers in Minnesota is working with all of our members who are assisted living, senior housing, home care members. So anything that they do related to, I can help them with, help them navigate, whatever they need, I'm there for them.
Absolutely.
Yeah.
What a wonderful service.
It's a fun job.
That's good to hear.
Yeah.
So this morning, or let's start with talking about assisted living.
Sure.
So in the state of Minnesota, in the field of elder care, it seems very confusing. There's assisted living, there's continuing care retirement communities, there's
Housing with services.
Housing with services. Let's start with the assisted living service.
Sure. Well, I think assisted living is the most confusing because in Minnesota, assisted living is not a license. In most other states in the United States, assisted living is a license that a provider has to call themselves. In Minnesota, it's a little bit different. In Minnesota, assisted living is technically a definition. And if a provider meets the definition of assisted living, they then can call themselves assisted living. But it's not a license, which is really unique. So part of assisted living providers is that they would have, a provider who calls themselves assisted living, they would have staff 24 hours a day. They would provide some healthcare services. They would provide some supportive services, and there's a myriad of list of services of what those could be. But that's, so they check a box on their registration with the state of Minnesota saying that they provide those services.
Well, that's interesting.
Yeah.
And seems a little frightening to me in some ways.
Yeah.
Are they licensed by the state at all?
They are licensed. So I think that's probably the biggest misnomer when people hear that assisted living is a definition. All assisted livings are licensed. They are held to high standards, that they meet the criteria to call themselves assisted living. So there is a lot of touchback, if you will, to make sure that people who are calling themselves assisted living are actually performing those services. Assisted living providers have a couple different things. They are registered with the state of Minnesota as a housing with services provider. So that's the kind of the housing side of assisted living. It's the rental side, and within housing with services, there's 17 points that a provider has to make sure that they comply with, and the biggest being that there needs to be a lease executed, just like an apartment that you and I would live in. Then an assisted living provider is also licensed as a home care provider. And that is where the survey, and that is where the healthcare services of assisted living are really held to high standards, if that makes sense.
Yes, it does. So they're licensed through the state of Minnesota.
Correct.
As housing with services.
They're registered.
They're registered.
Right, as housing with services. It's not a license, it's a registration.
Excuse me. So that registration is like a business, registering a business. Is that correct? Or?
Well, I think that it's similar. It's a registration that also identifies that you provide these services. that you meet the definition of assisted living, that you, if you are a memory care provider, that you also meet the definition of what a special care unit is. That's what our memory care and assisted living, they would meet the definition a part of this registration.
Okay.
Right.
Which goes back to what you originally started with is it's a definition, not
Correct.
necessarily a license.
Exactly.
Okay. So, but they are licensed through the state.
Absolutely. So they're licensed through the state as a home care provider.
Right.
So the home care regulation regulates all of the health care services that are administered within the assisted living community. That same branch of the Minnesota Department of Health, MDH, who issues that license, also oversees the registration, the housing and services registration. So there's oversight on both the housing and the healthcare services through the Department of Health and through the home care licensing division.
Okay. So it's confusing.
It can be for consumers, yes.
If I go to find a place for my mother,
Yeah.
and she needs help with bathing and dressing and eating, which is not a lot of care, but it certainly is some care. Now, how would I go to compare like different assisted living places, or should I look for a place that has a campus of services from assisted living through maybe death, or should I look at a CCRC, or what? There's all different kinds of terminology for housing with services. How do I compare one place to another so I know that I'm getting my money's worth, if you will?
Right. So, and I think that's probably the hardest thing for consumers to navigate. Because going and visiting and choosing an assisted living or senior housing or housing with services or CCRC, as you called it, which is continuing care retirement community, it's not comparing apples to apples. So our saying in the profession is, when you've seen one assisted living, you've seen one assisted living. So that is somewhat of the beauty of and the progressiveness of Minnesota, not creating a licensed assisted living, because it gives the consumer choice. So as a consumer and you're searching, I think the first thing you need to do would be to write down everything that you would be looking for in a community.
Okay.
I would just make a master wish list. And then, you can always whittle from there or make adjustments as you want, but make a master list. And then as you're searching, you can Google. The state of Minnesota has a website that I do know is being overhauled here soon, so it'll even just get better. The website is www.minnesotahelp.info. And that's a website that consumers can go to help navigate and find on their own different service providers. The state of Minnesota also has the senior linkage line. And there's a 1-800 number for the senior linkage line that people can call as well to help find places and help. The senior linkage line will provide you a list of places that might be in the geographic area you're looking in. There's also a lot of providers out there that will help navigate those services for you. So if you would just Google a service that may find assisted livings for you, there are services out there that help with that too.
Sure.
So then you just start touring. I think it's important to have a set list of questions that are important to you, and just start going. Then I think you'll decide how important it is to people, whether they have the next level set of services right there on the campus, or whether they're okay with moving if they ever would need to.
Okay, sure, absolutely. So you have to be thinking about what your mother needs right now.
Right.
And what she may need in 6 months or a year or a couple years.
Right, right.
When you're touring and making your master list.
Right.
Of services provided right in that particular, we won't call it a facility because no one likes the word facility anymore, but
right.
On that senior campus.
Yes.
So, excuse me, I forgot what I was going to say. So what would happen, Jill, if my mother's been on the campus of an assisted living for a year and a half and she's doing well, she only still needs help with bathing, dressing, and eating, so her health is maintained fairly well, and she's starting to run out of money.
Right.
And we've sold her house. There's no place for her to go back to now, and she can't live with me.
Right.
So now what do we do? What kind of resources would be possibly available for her at this point?
So there's kind of two sides to that question. Just as assisted living has a housing side and the home care side, it's a two-sided question for this too, because there are programs that help people pay for the services to live in assisted living. That program is called Elderly Waiver. It's a Medicaid waiver program that's executed by the state. But it is a Medicaid program, so you have to qualify based on your income. You know, and without getting into all of the details, basically you would have to spend down all of your income, or your assets rather, down to $3,000, and you would apply for medical assistance at that point. So there's a couple things that people really need to know. Number one, if that's a concern, I think financially you need to look out as you're looking at what healthcare services people might need. You also may need to look at how long the money may last. Because that might be it is a great question that people need to ask, is does the assisted living provider accept elderly waiver as payment for the services to live in that facility?
Okay.
There's a couple things that there are providers, it's not mandatory. There are providers who don't accept any elderly waiver, or EW as a lot of people call it. There are providers who accept unlimited number up to their capacity of elderly waiver, and there are also providers that have set internal limits because they can choose to say, I only have 10% of the residents living here can be on elderly waiver. And businesses choose to do that because it's a reimbursement system. So it's a really great question to ask. If the question wasn't asked prior to moving in, and you have concerns about whether the provider accepts elderly waiver or not, it's important to ask as soon as you think, or as soon as you're concerned about the money running out. And then if there's an internal waiting list, how that works. Does your mom, would she have to move apartments because she's in a beautiful 2-bedroom apartment, and she would maybe need to move to a 1-bedroom or studio? Okay. So those are the kind of questions that you'll want to start asking. If the provider that your mom lives in doesn't accept elderly waiver, then you'll need to probably start looking for another place, or your other option is to bring in a provider that accepts elderly waiver. You have a choice to bring in an outside home care provider to provide those services. But you would have to weigh the pros and cons, because the cost of living there, it may not be affordable anymore.
So the elderly waiver payment then doesn't pay for the rental portion, it only pays for the home care services. So
correct.
The bathing, the dressing, the feeding.
Right, and and some of the staff time to come in. So on the other side then, on the housing side, there is a supplemental rental program called Group Residential Housing, or GRH, that pays for rent, and the amount changes depending on each legislative session every year, whether or not it changes. But it's a set amount, and the group residential housing payment currently it's $876. So the group residential housing, or GRH as many people call it, will supplement rent up to $876. That's why if your mom was living in a 2-bedroom apartment, she may need to move to a smaller unit to accommodate that rental rate.
Okay. Okay.
Right.
Okay.
But it's not automatic, and that, again, another misnomer that many people believe that if you're on elderly waiver, you also qualify for group residential housing. And they are completely two different separate programs. Often, yes, people qualify for both, but there are times when people don't. They qualify for one but not the other. So group residential housing is a state-funded program,
Okay.
versus a Medicaid state-administered but national program.
Right. Right. Very, very enlightening information, and very confusing.
It is.
To try and figure all that out when you're looking for a place for your mother to live that's safe and she's going to be taken care of, and you can feel assured that her needs will be met.
Right. When you're applying for elderly waiver and group residential housing, it's through the county that people live in. So you apply through and then your mom, for instance, would be assigned a case manager through the county. And so that case manager will really help navigate those payer sources. So you may be making one initial application to be a part of these programs, but that one case manager is really the guide to navigating what resources are available, whether you qualify for elderly waiver, whether you qualify for group residential housing. So that one case manager should be a nice transition to understanding what's available to you.
Okay. Well, what a wonderful program and service for folks.
Mm-hmm.
So now I'd like to go back a little bit and talk about because we've talked about assisted living, we've talked about or assisted living, housing with services, and how that's paid for if you can afford to pay for it yourself. So let's go back, or let's move forward, and talk about the different types of assisted living.
Sure. Yeah.
Because I know there's many different types.
There are.
So say my list is, let's say now I'm looking for my aunt, and my aunt has a sizable estate, but she needs care.
Sure.
And she refuses to leave her home. She's not going to leave her home. So, I stop over there once a week after work and try and help her as best as I can, but I also have my mother in assisted living, so and I work full time, so I've got a lot of things going on, so I've suggested to her that we bring in some home care service. And she's kind of dragging her feet on that, but she's opened a little bit to that idea. And I've kind of switched topics on you, but so I'm wondering, and then we'll discuss the different levels of housing with services as we move on in our conversation.
Sure, yeah.
But I'm wondering about my aunt now. What do I do with her? How can I help her?
So let's talk about home care, because I mentioned home care and assisted living was a license through the Department of Health here in Minnesota. So home care in the community, and that's how I'm going to refer to it: home care and assisted living, and home care in the community, because it's not actually, it's in people's homes. They may be coming into a facility, but the agency themselves really is based not in a assisted living community. They may have a client in an assisted living, but their clients are spread out over the metro area or in a couple city region or something. So the license is actually the same. So how a community-based home care is licensed is a home care license that is the same license that an assisted living provider has. There are actually two different types of licenses for community-based home care. There is, it's called comprehensive home care license, which is a agency that can provide medical services, that can provide some medication administration, that can provide some bathing and dressing and grooming and help with ambulation or transferring. And then there's a second kind of home care license called a basic home care license. And that home care license is technically non-medical. They can help with chore services and housekeeping services and some shopping and maybe some standby assistance with a bath or a shower, but not any hands-on physical care for anybody. So you'll have to ask yourself, kind of make your list of what you're really looking for. So the first question I would ask you does your aunt need any medical services?
No,
Okay.
She doesn't.
And so, and anticipating going forward, the question will be, do we choose an agency that does some non-medical service, only non-medical services, or are you foreshadowing that not too long, that once your aunt gets kind of used to having somebody there, would she then benefit from having some medical services and maybe medication set up and some of those things that probably aren't too far down the line? And then if you chose that non-medical agency, you'd have to switch when the time came.
Yeah.
So, and there's nothing wrong with that, because now she's used to having someone come. But now you're having to switch to a medical agency and kind of go through some reorientation too with your aunt to a whole new home care staff. So there's no right or wrong way, right now with her needs, which one you choose, because both types of agencies could provide that non-medical service. It's just you'll need to look going forward what her needs are. And then do you want those medical needs taken care of in her home, or then are you best looking for assisted living? It's not simple.
No, it isn't, and it won't be simple bringing someone into my aunt's home either, because she's very particular.
Sure, certainly.
Now, let's just say, tell me a little bit, because I hear that there are Medicare certified home care agencies.
Yes.
And not, and what's all that about? That's confusing too.
Yeah. So there's agencies, so comprehensive home care is the medical provider home care license.
And that's just for the state of Minnesota.
That's for the state of Minnesota, yes. So a Medicare certified home care agency then has applied through Minnesota, but to be certified with CMS, which is the Center for Medicare and Medicaid Services, to be a Medicare provider, which means that if your aunt had some stay in the hospital, she had some hip surgery, let's just role play, and now she's ready to be discharged from the hospital, and she's refusing or doesn't need to go to a transitional care unit somewhere to help get some therapy in a facility, but can do that therapy at home. She then is most likely qualified to receive her Medicare benefit. So the agency that will come into her house needs to have that certification that they're Medicare certified. It's a federal standard that the home care agency has to comply with. And not all agencies are Medicare certified. So you would hopefully the hospital social worker at that point would navigate you to some options for Medicare certified agencies. And they then would come into your aunt's home, provide whatever therapy service, maybe some bathing assistance at this time, and helping her with some ambulation at this time that would be covered by Medicare.
Sure. Okay.
And she'd be able to use her Medicare benefit.
Okay. And that, again, then would be in anticipation if...
Right, yeah. And I don't know that you would necessarily as you were looking for just a home care agency to come in on a day-to-day basis, I don't know that most people would think, oh, let's have a Medicare certified one just in case, because those Medicare services are not long-term. And that, again, people think Medicare is going to pay for health care, and it's not a long-term payer source for healthcare services. It's a short-term payer source when somebody's in an acute need, and it most likely has an end date.
Right.
So in which case, if you had a non-Medicare home care agency
Already
hired there,
yeah.
You then maybe supplement the Medicare services with a different agency.
Sure, during the time, if she would need that, I mean,
Correct.
if she had had a hospital stay.
Exactly.
Medicare was going to pay for her rehabilitation in the
Exactly.
home for a period of time.
Correct.
So we could keep our home care agency that we had already set up a relationship with.
Right.
And as you say, supplement with a Medicare certified home care agency.
Exactly. Yep.
Okay.
That is one option. And a nice option too. The non-Medicare certified home care agencies often have great relationships, with Medicare certified home care agencies. So
Sure.